How prepared were we for a global pandemic, and how can we improve? That's the question we're diving into today. Let's start with a key player in the fight against COVID-19, Dr. Beth Cameron. As the Senior Director for Global Health Security and Biodefense on the White House National Security Council, she was instrumental in creating a pandemic playbook during the Obama administration. This playbook, unfortunately, was overlooked during the Trump era. As the seasons change, so too do the key players. Dr. Cameron is set to depart this spring, passing the baton to Dr. Raj Panjabi, the U.S. Global Malaria Coordinator for the U.S. President's Malaria Initiative at USAID. As we bid adieu to Dr. Cameron, we recognize her contributions to global health security. As we see, the importance of a pandemic playbook and its implementation is crucial. In the face of a global crisis, international collaboration becomes paramount. This truth is clearly demonstrated by the recent decision of the G20 countries to establish a global fund for pandemic preparedness. As we've all seen, the fight against a pandemic is not a battle any country can win alone. It requires a united front, resources pooled together, and shared strategies. These G20 countries, representing the world's major economies, have recognized this need for collective action and are taking steps to fortify global health security. They've provisionally agreed to set up a fund that would bridge the finance gap for pandemic preparedness, prevention, and action. This fund, with its global scope, is likely to be housed at an institution with an extensive international reach, the World Bank. But what's the role of the World Health Organization in this initiative, you may wonder? Well, that's an important question. The WHO has expressed its interest in having a decision-making role in this fund. Given its mandate to direct and coordinate international health within the United Nations system, this is hardly surprising. The WHO is keen on ensuring that this new fund does not undermine other crucial public health funding. The size of the fund, as well as the precise role of the WHO, is still under discussion. But the commitment to create such a fund is a significant step in itself. It shows a collective will to learn from the current crisis and prepare better for the future. The details of the fund are expected to be finalized in the upcoming G20 Health Ministers meeting in June. As the world grapples with the pandemic, the establishment of a global fund is a significant step towards better preparedness. It's a testament to the fact that when it comes to global health, we're all in this together. Is it time for a change in the global health structure? That's the question Tedros Adhanom Ghebreyesus, the head of the World Health Organization, or WHO, is asking the world. He's calling for a global treaty on pandemic preparedness and response. But what does that mean exactly? Well, it's all about fortifying our defenses against future health threats. It's about setting up a robust, coordinated international response to pandemics. The idea is that rather than each country fending for itself, we should pool our resources, share our knowledge, and work together to tackle these global challenges. Tedros isn't just calling for a treaty, though. He's also calling for sustainable and flexible funding for the WHO. Why is that important? Well, the WHO is at the heart of the global health response. It provides guidance, coordinates efforts, and helps to ensure that health support reaches the people who need it most. But to do all of that, it needs funding, it needs resources, and those resources need to be sustainable so the WHO can plan for the long term and flexible, so it can adapt to changing circumstances. But a treaty isn't just about money, it's also about cooperation. It's about member states working together, sharing information, and coordinating their efforts. It's about recognizing that in a globalized world, health threats don't respect borders. A disease outbreak in one country can quickly become a global pandemic, as we've seen with COVID-19. That's why we need a global response. Of course, a treaty is just a piece of paper unless countries actually commit to it. It requires international cooperation and commitment. It requires political will. It requires a recognition that we're all in this together, and that by working together we can protect ourselves and each other. A treaty could be the key to strengthening global health security, but it requires international cooperation and commitment. The COVID-19 pandemic has taught us the importance of being prepared. It brought to light the significance of strategic guidelines, as embodied in the pandemic playbook. It also underscored the need for collective action and financial readiness, as seen in the G20's decision to establish a global fund. Moreover, it called for a stronger, legally binding framework for pandemic response, a pandemic treaty. As we move forward, it is essential to learn from these lessons and fortify our global health systems for future pandemics.